Hello and welcome everyone. I'm Erin Ryan from the Massachusetts Health Connector. I'll be facilitating today's session. I'm joined by my colleagues Nikki Conti and Melissa Montrond, who will be presenting today's information. And we are here to help answer any questions you might have. You are joining the presentation, Health Insurance Options and Savings through the Health Connector. We have a number of participants signed up today, but we will get started at noon as scheduled. I would like to take a moment to thank elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been disabled. I will shortly pull up a brief 3-question poll that we will ask for you to take a moment to respond to. These questions and your responses will help guide today's presentation. You should see these questions on your screen now. The presentation portion will last approximately 30 minutes, then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the question and answer functionality. We will be monitoring your questions throughout. Please do not disclose any personal information or protected health information when you ask your question, as others on the call are able to see what you've written. If you have a particular personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's customer service and instructions on how to find help from a local navigator. We are recording today's webinar, so following today's session, you'll receive an email with the presentation, so there's no need to take detailed notes. At the end of the session, we'll also display some evaluation questions. Please, again, if you can respond to these questions, your feedback on today's session will help us improve future presentations. So I'll take just a moment here while individuals, if you can, again, you might see a poll up on your screen. If you can take a moment to answer those questions, they will help guide our conversation today. And I'll just give a moment for everyone to respond. Thank you. Okay, great. It looks like we have most people have taken the opportunity to respond. So I will go ahead and share the poll results. And I am joined by Nikki Conti, who will kick off the presentation for us today. Good morning, Nikki.
Morning, Erin. Hi, everyone.
So if you can see the poll results on your screen, Nikki, it looks like the majority of our attendees are here today to learn about health insurance options for themselves or a family member or a close friend. The majority are actually, there's a good spread of what they're interested in learning today, but the majority are definitely interested in learning about a health plan that might meet their needs. And it looks like our attendees may already be familiar with the Health Connector, but a few may be coming from potentially COBRA coverage or have coverage through an employer currently. So we will do our best to kind of keep that in mind as we move forward with the presentation.
Okay, great. Folks, again, thank you so much for answering those questions. It really does help us. It helps orient us as we're going through the session. So welcome to this presentation on health insurance options and savings for the Health Connector. And I'm here today. I'm also, in a little bit, I'll be joined by my colleague, Melissa, and we want to talk specifically about coverage for individuals and families. So on this next slide, we will go over these segments today. We will orient you to the Health Connector. So if you don't have any experience with us, we just want to provide some background. Then my colleague Melissa is going to go through some details about getting individual or family coverage. She specifically will talk about applying. We'll cover information on how to get free help, and then go over some key reminders, show you where to get some resources, and we'll also have an opportunity to do some demonstrations with you. So what is the Health Connector? If you aren't familiar with us, we just want you to know that we are the state's health insurance marketplace, and we're here to offer insurance options to individuals, families, and small employers. Basically here to offer coverage to someone who is uninsured, doesn't have access to coverage, and may need it. So typically people who get insurance typically people who get insurance through us qualify for help paying for those premiums. So a lot of people do that, and especially now, even more people qualify for savings because of the American Rescue Plan. So we'll talk a little bit about that. Folks can also buy dental insurance through the Health Connector. And then it's worth mentioning, but we won't go over it in detail today, but it is worth mentioning that if you are a small employer with less than 50 full-time employees, we do have health insurance coverage, health and dental plans available through our Health Connector for Business platform. So for Health Connector plans for individuals and families. So on this slide, I really just want to go through some key concepts, key terms for you, so that as you're going through this slide presentation, you have kind of background information for yourself. So first and foremost, all the plans sold through the Health Connector meet state and federal standards for coverage. So what does that mean? So in Massachusetts, we have an individual mandate for adults to have health insurance coverage. So if you have coverage through the state's Health Connector, you never need to worry whether or not these plans that you're enrolled in through the Health Connector meet either state or federal standards. You would not be penalized for having coverage through the Health Connector. Now, all of the health insurance plans that are sold through the Health Connector are considered qualified health and qualified dental plans. And depending on where you live, you'll be able to choose from a variety of plans. And these are leading carriers in Massachusetts. Now, in the center column here, we start describing health plans with advanced premium tax credits. So this might be a new concept. This might be something you've never heard about before. But essentially, if you're coming through the Health Connector to get coverage, you could qualify for tax credits that reduce the cost of your monthly premium. So we'll spend time talking about that in future slides. And then the Connector Care Program. This is a program that is unique to Massachusetts, in people in lower income brackets and who meet other requirements may qualify for low or no cost insurance plans, insurance coverage. So these are great plans, comprehensive coverage. There are, again, low or no cost and very, very affordable cost sharing for the consumer. Now, you may be seeing catastrophic plans. You might see some plans as you're shopping that seem quite affordable. We'd like to caution people that, first of all, the catastrophic plans are available to people under 30 years of age or with a hardship exemption, but we do like to caution people. So part of the reason the catastrophic plans are, the cost of the premium is low is because the consumer share of the expenses when you go to get a service, etc., are higher. So just a word of caution as you're shopping if you look at the catastrophic plans. And then, of course, just want to note, we do have dental plans for individuals, families, and small employers. And I've already mentioned Health Connector for Business. So if anyone needs any information about Health Connector for Business, you can go to our website, mahealthconnector.org. And you'll see a link to get more information about that. And also, if you're interested in a webinar specifically about Health Connector for Business, you can search on Eventbrite, and we have those set up quarterly. Now, I briefly mentioned the American Rescue Plan, so I just want to describe it at a high level. So this was recently signed into federal law in March of last year. And as it relates to health insurance coverage, it is making financial help more available to more people. So a lot of people who are already getting help paying for coverage through the Health Connector are now saving even more. And now people who didn't qualify for help can also get this advantage of lower monthly premiums. So we do have a cost estimate, plan estimate or get an estimate tool available from our website. The link is here, but this is something my colleague Melissa is going to step through after. So we will do a demo of this for you. Now here, I'm actually going to hand this over to my colleague, Melissa. I keep mentioning her, so I will actually introduce her and let her go through this section.
Thank you so much, Nikki, and good morning, everyone. So I'm just going to go over who can apply. So you should apply if you live in Massachusetts, are a U.S. citizen, U.S. national, or otherwise lawfully present in the U.S., and don't have health insurance. You should not apply if you are enrolled in Medicare, Mass Health or Medicaid, or other public health coverage, are offered affordable, comprehensive health insurance from an employer, or if you are in jail. When can you enroll? So we have a special enrollment period. So basically, if you have a qualifying life event, you can enroll in or change health insurance plans outside the annual open enrollment period. Life events that let you qualify may include changes in household makeup, income, immigration status or address, certain other life changes like getting married, having a baby, or losing job-based health insurance. You want to report any qualifying event within 30 days of it occurring. You have 60 days from the date of the qualifying event to select a new plan. Payment and enrollment deadlines still apply during a special enrollment period. Applying for coverage. So there are 3 ways that you can apply. The first way is by going online at mahealthconnector.org. We also have a Spanish version, which is the mahealthconnector.org/es/. The second way is by phone, and the third way is with the help of a partner community organization or health center. There is one application to find out if you qualify for coverage through Health Connector, including help paying for coverage or for coverage through Mass Health or Medicaid. You will get letters from Health Connector and Mass Health that tell you your next steps. What you need to apply. So you need a few things. You will need the Social Security numbers for everyone applying if they have one. Immigration documents for all non-US citizens who are applying if they have one. And you can learn about these documents in the link provided, which is the immigration documents. You will also need your recent pay information if you have it, such as copies of your last 2 pay stubs, your unemployment amount, which is the monetary determination if you are collecting unemployment, and any other information about your current income. If you don't have all the information above, just send us what you have, and if we need more information, we'll ask for it if we need it. So application for individuals and families. So to apply, you want to go online and you want to go on mahealthconnector.org. And again, I just want to mention that we also have a Spanish version for Spanish speakers, which is the mahealthconnector.org/es/. So there's only one application for applying for Health Connector, Help Paying, and Mass Health. So here is just our website. This is the front page. So basically, we circled sign in, and we also circled create an account. So basically, If you already have an account, you just simply sign in with your email and password. But if you need to create an account, you just create an account and just provide us with your email and password, and you are able to apply that way. How do you enter income? So when you complete an application, you'll be asked about your current income and your estimated income for the year. So what you want to do is enter your current income as it is right now. So that's whether you have a job or including unemployment income. Then you enter your expected yearly income based on what you think you'll make over the course of the year. When entering your yearly income, you want to consider how much you earned so far this year. You want to add any unemployment, and if you think you'll be returning to work later this year, include what might be earned. If your income changes later, just update your income so we have the most updated information as possible. Keep your income and your application up to date. Remember to update your income if your employment situation changes. Keeping your income information as accurate as possible helps make sure you get the right amount of help paying for your health and dental insurance. Have a lower risk of owing money to the IRS when you file taxes next year. If you get advanced premium tax credit, which is the APTC, you can always adjust the amount you take by clicking on the Change Tax Credit link from the Find a Health Plan page of your application. Be sure to send in any documents you owe in the required 90-day time frame to help avoid issues. So I'm just going to pass this back to Nikki.
Thanks, Melissa. So I'm just going to continue on here and just talk a little bit more about getting help paying. So Melissa mentioned, I mentioned this a little bit, Melissa talked a little bit about this as well, but as you can see, there are two kinds of help paying that you can get when you're applying through the Health Connector. You could qualify for advanced premium tax credits, and those are exactly as they sound. These tax credits lower the premium amount you pay each month. You get them in advance. The IRS is going to send that tax credit directly to your insurance company, so you'll just pay less each month. And then you are, if you qualify for tax credits, there's going to be a total amount that you qualify for. So you can choose to apply some or all of your tax credits to reduce your monthly premium payment. Many people simply choose to apply whatever it is that they are eligible for. They apply the entire amount to help pay for their monthly premium. Now, I also before had mentioned the Connector Care program. So the way in which we are able to keep the cost of that program low for you is it uses both the advanced premium tax credit, so the federal dollars plus the state dollars, and those two together help reduce the premium amount that you pay each month. So that's what keeps the cost low for you, the consumer. I also mentioned before that the Connector Care program has low monthly premiums, low out-of-pocket costs, no deductibles. So depending on the plan type you qualify for, you could choose a plan as low as $0 or $134. So there's some detailed slides at the end of this presentation, and you will get a copy of this presentation by tomorrow. Typically within 24 hours, we send a follow-up email. You'll have this presentation, you'll have all these links, and you can see these resources as well as this information is available on our website. So I wanted to just talk a little bit about income guidelines. And there are income guidelines that we use to help people figure out if they can get some assistance paying for coverage from the Health Connector. So if you look to the left here, you can see on this table, we have the household size, and then in the center, it says Connector Care, 300% of the federal poverty level, and then to the right, advanced premium tax credits. So here I'll just say, let's say we're looking at a household size of 3. And if that household is making 65,160 or less, and they meet all the other eligibility requirements, it is likely that you or that household is going to qualify for connector care plans. Now, on the right here, the column where it says APTC, we used to have, before the American Rescue Plan was signed, we had a income limit for those who could qualify for advanced premium tax credits. So you can see that marked here. Now, the American Rescue Plan actually removes the income limits. So now people with income greater than 400% of the FPL can qualify to get these tax credits. So instead of an income limit, we're actually looking at the kind of like overall affordability of the plans per application. So the advanced premium tax credits are going to be available to help lower the cost of the monthly premium. So it's not more than 8.5% of the total household's income. Now, before we go on to this section and start looking at talking about plans and enrolling, Erin, I think we just want to stop here and just see if anyone had any questions. I know we've covered quite a bit. We've gone through like who we are. Melissa's gone through, you know, what exactly people need to apply, etc., and what we could qualify for. But does anyone have any questions at this point that we could help?
Yeah, thanks, Nikki. So again, for anyone who does have questions throughout the presentation, please feel free to use the Q&A functionality at the bottom of your screen, and you can just type it in and we'll monitor. But Nikki, we do have a few questions. So if a household is applying for coverage and somebody in that household has coverage through an employer, how do they go about applying? It's somebody's partner or spouse, are they eligible to apply through the connector? What do they do with the individual who has access through an employer? How do you kind of work with that?
Okay, that's a really great question, Erin. So when you're applying for coverage and you're going through the application to apply for coverage, we actually need to know about your entire tax filing household. So we'll ask questions about who's in your household, and then we also ask whether or not that person needs health insurance coverage. So one of the things Melissa mentioned was that if you, if you have access to coverage through an employer, so it might not necessarily be from your employer, but let's say it's your spouse or your partner's employer, you likely will not be able to get health insurance coverage through us because you already have access to coverage. But we know that there are some people who, let's say their partner might have coverage, but they do not have access to get onto a family plan, etc. So you would want to enter all the information about the household members. If somebody is listed as a household member, you can indicate that they're not applying for coverage, because just because they're in part of your household doesn't necessarily mean that they need coverage. And sometimes we see this scenario when we have older couples who are applying for coverage and one member is on Medicare, and then the other person maybe doesn't qualify for Medicare yet. So they list both people and then they just indicate that one person doesn't need coverage.
And do you list the income for all these individuals then as well?
Yep. So when you're thinking about income, I think it's important to note that we are interested in the tax filing, your whole tax filing household. So anyone that you're claiming at tax time, we would need to know income information for all of those people.
Great, thank you. And one final question for now, but again, please keep these questions coming. When we talk about applying for coverage and how Mass Health and the Health Connector use the same application, but how are they related to one another? And can you choose which one you're applying for or where you want to receive coverage through?
That's a really great question, because I think we allude to it, but we don't say it like definitively. So if you come to mahealthconnector.org, we have a joint system. So when somebody is starting the process, you don't need to know that, you don't need to think about or choose, I want to apply for Health Connector, I want to apply for Mass Health. What you're doing is basically entering all of your information, you're letting the system do the work, and then it will determine, based on all the information that you've entered, if you meet Mass Health guidelines for coverage or Health Connector coverage. And that's basically how it works. We have, of course, people who apply as a family, and some family members, the parents may be on Health Connector plans while the children are on Mass Health plans. So it's not necessarily, you don't have to know going into the process what exactly you're looking for.
That's great. And so the application will essentially do the work for you and let you know what you're eligible for.
You got it.
Great, thank you. And again, keep the questions coming. We'll revisit them at the end.
Okay, great. All right, so there are just a couple more slides. I almost forgot who was going next. So there are just a couple more slides, and then I'll turn this over back to Melissa. But Melissa mostly went through all of the application parts, right? So all the things you need to do to figure out what you're eligible for. But then, of course, you will need to choose the right plan. So we have some online tools where you can enter some of your preferences. So you might be thinking, okay, I've never had to shop for health insurance coverage before. Where do I start? We tell people to start with the list of providers, doctors, specialists that they need, or let's say medications that you know that you want to be sure are covered. So these tools let you enter provider, medication preferences, so you can find plans and also see their pricing. Now, you can use these tools when you're in the application, but before you apply, you can also use these other tools. So you can use the plan comparison tools to look at your plans based on provider and medication preferences. And then you can use the get an estimate tool to find the leading carriers that are in your area, see what they would cost, and see what the monthly savings would be. This slide here shows you what it looks like when you're in your application and you're entering your preferred providers and facilities, as well as preferred prescription drugs. And then after you've entered your preferences, you could see circles here on this slide. You can see a couple of different doctors' names, as well as a facility, a health center is listed here. So as you're going through the process, any preferences that you enter, you can use and you can filter your preferences. You can filter the plans by those preferences. Now, all of these things are things that you can do online through our application. After you've made your selection, and many people are required to make a payment. So I think what's important to note here is that if you are making a payment, it needs to be received by the 23rd of the month before your enrollment is considered complete. So you can do this part online as well. You can submit. You could submit the make a payment button using from this page. This is my enrollments page. And really important to note here is that if you're making a payment with us, payments can only be taken from checking or savings accounts. You can, again, you can get to this button, or you can get to this area when you're in your application, but you can also sign into your account. You can also make a guest payment. And some people are using this new functionality we have, where they call customer service, and they can make a payment over the phone. And lastly, of course, you can mail in payments. Now here, I'm going to turn this back to Melissa to go through the next couple of slides.
Thank you, Nikki. So now I'm going to go over getting help. So customer service and community partners. So we offer free enrollment assistance, which is available through the Health Connector customer service and across Massachusetts through community partner organizations. So our customer service number is 877-MA-ENROLL, and that number is 877-623-6765. We also have a TTY number, and that number is 877-623-7773. And that is for people who are deaf, hard of hearing, or speech disabled. For information about hours, days of operation, and more, you can go to the Health Connector Customer Service Call Center. We also have community partners who are trained and certified navigators and certified application counselors who speak many languages, can help you from application through enrollment into health insurance plans. They can answer questions about eligibility, the application, payments, plan details, and healthcare reform rules and requirements. It is recommended that you call ahead to schedule an appointment for help. And to find help in your language, you can go to the Get Free Help near you. So the new Health Connector simple sign up checkbox on DOR scheduled HC. So simple sign up is an easy way for Massachusetts taxpayers to get help getting into health insurance coverage right from their 2021 state tax returns. By checking the box, taxpayers are letting DOR and the Health Connector know they are interested in getting help enrolling in health insurance from the Health Connector. The Health Connector will then reach out to the taxpayer about how to enroll in health insurance coverage with personalized help. Schedule HC is a Massachusetts state tax form where individuals report any health insurance they had during the year. Please note that married taxpayers must both check the box to have their information sent over. So new language on scheduled HC. So basically you might be eligible for low or no cost health insurance coverage. So if you and your spouse, if married, filing jointly, do not have health insurance coverage, you might be eligible for health insurance coverage programs made available by the Commonwealth of Massachusetts. So by filling in the oval below, you authorize DOR to share information from your tax return and attach schedules with the Health Connector. If you are married filing jointly, both spouses must check the box for the Health Connector to receive all your information. The Health Connector will assess your eligibility for those coverage options, including low or no cost coverage, and contact you with information. So basically the instructions are below. So you want to check off whether it's for you or for your spouse, whether or not you authorize that information. So now I'm going to pass this back to Nikki.
Thanks, Melissa. So yeah, that's a new, something new and something you may see as you're doing your taxes or you may have already seen. So we wanted to let you know about that, certainly as we're in tax season. So we are nearing the end of the slide presentation. So we just want to remind everybody that the Health Connector does offer coverage for individuals, families, small employers in Massachusetts, individuals and families whose income might have been too high in the past could now qualify for Health Connector plans with savings. And what we want to encourage people to do is, you know, if anyone out there needs coverage, simply apply. The Health Connector does have an open enrollment period each year. And then if we're in a closed enrollment period, people can get in if they have a qualifying life event. So that will let someone enroll any time of the year. But it is necessary to say that, You know, if you need coverage, apply, because you may find that you're eligible for mass health. You never know with the changing circumstances what somebody might be eligible for. For those of you who mentioned that you are in COBRA or coming from COBRA, keep in mind that losing employer coverage, losing help, losing access to help paying for COBRA, these things are considered qualifying life events, and they'll give you special enrollment periods that allow you to get coverage through the Health Connector. And we just want to be sure you apply and compare your options with us within 60 days of losing that coverage. So again, around deadlines here, you'll need to apply, enroll, and pay your first premium by the 23rd of the month before your coverage can start on the 1st of the following month. So as an example, you want to pay by March 23rd for coverage to start April 1. And technically, you can also choose your coverage to start on the 2nd month after you enroll. And as Melissa had explained, you can apply for coverage online, over the phone, with the help of an assister who works at a community partner organization. And of course, you can report changes. We actually want you to report any changes to your circumstances. You can update your application anytime, or you can call in to make updates. And then lastly here, there is free help available across Massachusetts. So particularly right now, if you need any assistance as you're going through this process, we really would encourage you to call and make an appointment to schedule some time. But before we go to questions, I should pause there. Before we go to questions, I'm wondering if Melissa, you want to jump in and walk us through a demo?
Yes, thank you so much, Nikki. I would love to. So I'm just going to take over for a second. This is my favorite part of the meeting. So I am going to go over the Get an Estimate tool, which is basically an overview of your savings. So this is something that I like to go over with members before they actually apply, just to see exactly how much you'll be saving. So if you go on top of the page and you just hover above the Get an Estimate, you will see two options. You will see individuals and families, and also businesses. So I'm just going to click on individuals and families. And then I'm going to scroll down. So basically on this page here, you just have to answer a few questions. So I'm going to click off 2022 for the coverage year, and then enter your Massachusetts zip code. And then here it says, enter what you think your household income will be for the year. And I'm just giving an example. Here, I'm just going to select that it's a family of 4. And it's going to ask for the age of head of household. I will say 35. And then person number 2, 33. And then I will have 3 and 4 maybe as children, 13 and 5. So also I want you to take a look and see, for each time you list the age, you also have to look at the side. It will give you a few more options here. So you want to check off whether or not this person needs coverage. You want to include whether or not this person is pregnant, and then also include whether or not this person is disabled or blind. And once you do that for each person, you want to go to your results. And then here is just a reminder that this isn't an application for health coverage, and that's okay. So we want to continue. Okay. So here on this page, we are getting the estimated eligibility for this household. So based on what you told us, your household may qualify for an advanced premium tax credit to help lower your monthly health insurance premium costs. So your maximum tax credit amount is $709. You are eligible for silver plans with monthly premium as low as $2.74. Those are huge savings. So here it's broken down even further. So you see your household member, each member that I had listed with their age, and you also see the potential eligibility. So let's just say it's a married couple with 2 kids. So you see person 1 and person 2, they both are eligible for connector care plans with advanced premium tax credit. And then person 3 and person 4, which are their children, they will be eligible for free or low cost coverage through Mass Health. So I know that earlier we had indicated how, you know, you can apply and you may be eligible for the connector plan or Mass Health. So this is a good example of a household that they all qualify, but for different types of insurance. So now we can preview plans. So basically, this is another breakdown. It will give you the Health Connector plan options for the couple. Keep in mind the children do get the Mass Health, but this is for the couple only. So we see here that these are the carriers available in their area. And then we have the plan names, we have the coverage level, we have the monthly premium cost. And now we have the APTC savings, which is the advanced premium tax credit savings. We then have the Massachusetts state savings and what you pay monthly. So for this couple, the savings are huge. They get the APT savings of $699.16. And so basically what they would be paying if they selected them, which looks like the most affordable one here listed, the Boston Medical Center Health Net plan, they would pay $2.74 a month because of the advanced premium tax credit savings that they would get. Or if they chose the Tufts Health Plan public plans, they would be paying $34.96 per month based on the advanced premium tax credit of $709. So then the list goes further. So it's just a lot of savings here. It's a great opportunity here. If you want to apply now, you can click on apply now. It brings you directly into the application. If you want to start over and put in other information to get another idea of savings for maybe if you wanted to include someone else in the household or you made a mistake, you could always go back. So it's a really great tool to have.
Awesome. Thanks so much, Melissa. And I think, Erin, we might have more time, right? Because I'd love to show people the other demo of the other tool as well.
Yep, absolutely. That would be great.
Great. So I'm back at the Health Connectors landing page where Melissa had started from, and I'm just going to go to the Help Center, slide down and select Resource Download Center. And there's a lot of actually helpful tools here. So if you have some time, you should certainly check this page out. There are different guides, different flyers, but I'm going to start with the very first tool, which is that Plan Finder tool. And if I click on this, basically this tool is going to let me see what providers and prescription drugs are covered by the health and dental plans. So Melissa showed you the coverage and the plans that were available based on the family size, their income, and where they lived. So here, I'm sorry, I probably won't use as many people, but I will just say, all right, based on, let's say someone was living in the Boston area, we knew that they qualified, or you know that you're qualifying for connector care, and it looks like that couple was qualifying for plan type 1. So I'm going to indicate that. And if you're using this and you're not sure, you can certainly say, I'm not sure. You're just asked a couple of more questions. But more importantly here, you can enter the name of your doctor that you want to be sure to include in the plan that you select. So here in the provider search area, I entered the name of the physician that I want to be sure gets included. So once her name is there, I click continue. I come to this next field and it says type in the facility name. And I'm actually going to type in a health center that I want to be sure I can go to. And you can also type in a hospital that you want to be sure is included in your plan. So a facility essentially is, hospital, health center, something like that. Now I'm at the point where I can enter prescription drugs. So here I want to, excuse me for one moment. So here I want to just enter the prescription that I want to be sure gets covered. And I'm going to say 500 milligrams. So I've entered metformin, 500 milligrams. And now what I'm seeing, so this plan results page or this plan comparison tool gives me a set of results, sort of like what Melissa had, but with different fields here. I'm seeing my preferences, so my doctor, the North Ave Health Center, also the medication that I've listed on the left-hand side. And in the center here, I am seeing the health insurance carriers that you can see the medication that I was wondering about is available from all 3 of the carriers. The doctor is available from all 3 as well. But it looks like the only plan that covers the health center is going to be the Always Health Partners plan for connector care. So we wanted to show you these two because basically these two tools together let you conduct your search before you even complete an application. So I hope that's helpful.
We do have a few questions, and for everyone who, if these questions spark more questions or you want to share a question, please use the Q&A functionality at the bottom of the screen. But so an eligibility question, Nikki, can people who are unemployed, can they apply through the Health Connector? And then maybe if we can talk about also kind of how that works with COBRA options as well. But are unemployed individuals eligible?
Yes, so that's a great question and really timely, of course. If you're unemployed and you suddenly that you're going to be losing access to health insurance coverage soon from your employer, you should certainly apply for coverage through the Health Connector. So one of the things that we'd mentioned in the presentation is that you have a window of time that you can apply so that you have a qualifying life event. So it's 60 days from the date of loss of coverage. So you can let us know in advance, you can let us know after, but it's within a 60-day window.
Great. And so if somebody had, lost or maybe became unemployed, enrolled in COBRA, are they able to, let's say the COBRA costs are becoming unsustainable, would they be eligible for coverage through the Health Connector?
So that is it's a little tricky, but we'll kind of step through it. So we know that sometimes people have the option to enroll in COBRA and the employer might pay for some of that coverage. And COBRA can, if people aren't as familiar with COBRA, I think it's important to note that COBRA is the same exact health insurance plan you had from your company or employer. It's just without any contribution from the company or your employer. And so sometimes people see that amount and it's pretty surprising to them because they didn't know how much the coverage costs. So if somebody is given the option of enrolling in COBRA, technically, if they choose COBRA, they cannot unenroll from COBRA to get into Health Connector coverage. However, there is a recent qualifying event where if somebody loses help paying for COBRA, they could in fact get a qualifying life event. So if somebody was getting, I'll just keep it simple and say if the employer was still contributing some money, let's say for 6 months, and then you still don't have health insurance coverage, you should certainly apply for Health Connector plans and you can drop out of COBRA. So I think hopefully that's helpful for some.
And during the regular open enrollment period, is that are they able to make that movement then as well?
Absolutely. So again, all of this depends kind of on the time of the year these things happen. So if the person is, let's say this happens, I don't know, let's say it happens towards the end of the year, our open enrollment begins on November 1, and it's for coverage that starts on January 1. So just kind of keep that time frame in mind. Health Connector is totally open during that time for anyone who needs coverage for any reason at all. They don't need a special qualifying event. But again, that's for coverage that begins on January 1. If somebody was getting some help paying for COBRA and that help is going to end, let's say in September, so they could technically get coverage with us beginning in October because that help is ending in September.
Okay, great. So great to, if people are having a change in circumstances, losing their employment or their coverage through their employment, definitely worth checking with the Health Connector maybe before making a big lump into COBRA, depending on, what options might be best for them. So that's great. Thank you. So we've used the term coverage level, and there was just a quick question if we can kind of clarify what coverage level means exactly.
Okay, so I'm going to do my simple version of this, Melissa. Feel free to chime in, Erin, you too. Because when you are shopping through the Health Connector plans, you may know, depending on how you're going through the application or even going through our website, you might see bronze, silver, gold, platinum plans. So our plans are organized by tier or coverage level, if you will, and they're grouped. I want to say this as simply as possible, but they're grouped by actuarial value. But what does that mean to the consumer? They're grouped by how much you, the consumer, pays versus how much the health insurance plan pays. So, for example, if you chose a plan that was in a platinum tier or platinum coverage level, you are paying more each month for the premium. However, the health insurance carrier is paying more at point of service as you use the coverage, and your co-pays are going to be less. Now, also true is if you decided to go with a bronze plan, like a lower level or lower tier plan, you would be paying less each month. Every time you made your monthly premium, that amount is less. And the carrier is paying less as well. However, when you go to get a service, you as the consumer will pay more for that service. I hope maybe we can ask the person if that helps or if we clarify that for them.
Yeah, I'll definitely circle back to make sure it helps. But I think that's, and I always think of it like Olympic medals, although
Yep.
there's the platinum, but essentially, yeah, just, they range in how much you're paying kind of upfront, and you might experience, you have lesser out-of-pocket costs down the road, or you're paying a little bit less on the front end. So I think that's helpful, but I'll definitely circle back and make sure there aren't follow-up questions there, or please feel free again to use the Q&A functionality to continue asking questions, or let us know if you had a follow-up question from that. And then Nikki, another question that we have is another eligibility question, and kind of access to other forms of coverage. So if there's a college student who may have kind of access to coverage, maybe through a student health insurance plan offered through their university or their college, are they eligible to apply through the connector, or kind of what are the nuances there?
Okay, so I think the best way to think of, or the best way for me to think about this, and hopefully this helps all of you, is that as you're going through the application, whether the person is a student or whatever the situation is, you just want to try to answer the questions as correctly as possible. So we're going to be asking questions about the person's age, whether or not they're enrolled in coverage, right? Or so for that student, if they're enrolled in a student health insurance plan, they will not be able to get access to Health Connector coverage or get help paying for their Health Connector coverage. So I think that's really important to know. And then I think another question or some more information about students that we usually get is that, depending on the family structure, of course, children or dependents can stay on their family's plan up until they're 26. So kind of that's another thing to keep in mind. So yeah, I hope that helps.
And so I don't know if this kind of presents a different question, but just as part of your answer, if you're protected in your parents' plan until 26, say your family you're already Connector Care members, they wouldn't necessarily have to maybe update their application just if their young adult, child, or dependent starts attending college. Are they then protected in that same way, or is that something maybe we can follow up in the email tomorrow with more information?
So give me more info. So if the whole household, it's okay. So if the whole household is on the application and one member is in college and is getting student health insurance, let's say.
Or so actually, this is something that your answer sparked a question for me. Okay. So let's say the dependent isn't in college yet, okay, but the household is enrolled through the Health Connector, and then the individual moves on to their higher education. Are they still then able, because they're protected until the age of 26, to remain on the Health Connector as part of that household?
I think we should follow up on that one. And
sorry, Nikki, doesn't that
just no, I think we should follow up on that one and see how to best answer, because I think it's going to depend. Is the person still a tax dependent? Sometimes people, sometimes students start filing their own taxes at a certain point, and so we will certainly follow up with that. But these are good questions, especially as we're getting close to graduation. This is a time of year where people kind of start asking and thinking about these things more.
Absolutely. And as the seasons change, one final question on kind of updating the application. Some people are seasonal employees or have seasonal work. And you noted to come back to the application, update your income information as often as you can based on any changes. What really happens? What if somebody maybe doesn't work as much as they were expecting? And what happens if they don't update their income information? What happens with those benefits? Are they just at a loss, or kind of what happens?
So I actually would love to turn to Melissa for this, because I feel like she has some true real world experience with some of the folks that she helps.
Yes, thank you so much, Nikki and Erin. So yeah, I always tell people, keep your application as updated as possible. You want to make sure you're in the eligibility that you're qualified for. If you are earning less, go into the application and just put that you're earning less, and you may be paying less in monthly premiums if that's the case. So I'm really big on that. Even if you're earning more, you want to go into the application and just, show that, feel comfortable updating your income. Because during tax time, when it's time to file your taxes, you want to make sure that you have provided the most accurate information, because you don't want to owe anything during the tax time. Or any surprises come up because we didn't have the correct income information. So definitely that's a big thing that I always remind everyone to do. So thank you so much.
Great, and so that is it for our questions this afternoon. Thank you so much, Nikki and Melissa, for such a very helpful, informative, and in-depth presentation. Before I pass it over to you for one final sign off, I will be pulling up our evaluation on the screen as well. If everyone can please complete that before they log off, that would be great. And Nikki, Melissa, any kind of last, final reminders that you want to send our guests away with?
Just thank you for attending. Please complete the evaluation. It helps us. And Melissa, I'll hand it to you.
Okay, thank you. I just want to again thank everyone for attending. We're here for you. If you have any trouble with the application process, we are here. Feel free to call us. I did provide the customer service number during the presentation, but we are always here to help you through the entire process.
Great, thank you so much. And you are now seeing the evaluation on your screen. Again, if you can take a few moments just to answer the 3 questions, you may have to scroll down. That will be so helpful for our future webinars. Thank you and have a great afternoon.